Today we will be discussing hypersensitivity with Brittany Resner, Adrian Rubio, Jennifer Garcia, and Rochelle Howerton-Smith, part of Laura Knoll's immunology class at Tarleton State University.
Type 1.
This is Bob. Bob loves food. One day, Bob went to a restaurant and ordered a fried chicken sandwich. 2 bites into eating, he began to get hot and noticed that it was hard to breathe. He did not know that his food was fried in peanut oil. However, Bob has an allergy to peanuts. No, not this kind of peanut, but this kind of peanut. An allergy is a hypersensitivity response to an environmental antigen. A peanut allergy is a type 1 hypersensitivity and is an immediate reaction after contact with a soluble antigen that you are allergic to. It is IgE mediated. And type 1 consists of most common allergies, such as animal dander, pollen, latex, and dust. There are many different severities to allergic reactions. Some people may just have a minor rash, while others can have extreme anaphylactic shock where their air passageways close. Bob has type 1 immediate hypersensitivity, atopy. Atopy is a genetically determined hypersensitivity, usually referring to allergic patients who produce high amounts of IgE when exposed to small amounts of antigen. Now let's take a look at what happens within Bob as he ingests the peanut. Once the antigen is in his body, it is recognized by the antigen-presenting cells, such as a dendritic, macrophage, or B cell, and is then taken up to be transported to where it can be presented to a T helper cell through interleukin-4. The T helper cell then stimulates the B cell, which differentiates into a plasma cell, which can produce IgE. Specific IgE for the allergen is recognized by the mast cell and is sensitized by the cross-linking of the IgE by the attaching of the Fc portion to the surface receptors of the mast cell. Second contact with the antigen can directly attach to the cell-bound IgE, which then induces cross-linking that stimulates the mast cell to degranulate, thus releasing its contents. Here is a mast cell before and after degranulation, as leukotrienes and histamines are released, which can cause smooth muscle contractions and vascular permeability, causing you to have runny nose, watery eyes, or bronchial dilation. Treatment is the use of an EpiPen, which releases epinephrine that helps loosen the muscles that constrict the airflow during an anaphylactic reaction. Soon, Bob will be back to his normal self, doing what he loves. Take it away, Adrian.
Thanks, Brittany, for the introduction. I'm going to be presenting to you hypersensitivity type 2, which is also an antibody-associated reaction. So what exactly is a hypersensitivity type 2 reaction? Well, it's a reaction that causes destruction of cells through an antibody-associated process. Well, what does that mean? Well, we basically have 2 antibodies, IgG and IgM, that initiate destruction of cells through an immune complex or through a cytotoxic mechanism. The immune complex, I'm referring to the classical pathway, and for the cytotoxic mechanism, I'm referring to antibody-dependent cell-mediated cytotoxicity. This slide shows the key potential players involved in hypersensitivity type 2 reactions. The first big category we have are lymphocytes. This includes the plasma cells, the B cells, the memory B cells, the Th2 cells, the cytotoxic T cells, and the macrophages. Just like the previous slide, these are just some of the key proteins and key cytokines that are involved in hypersensitivity type 2 reactions. This is a slide that is showing some of the most common type 2 hypersensitivity reactions. The first one is the transfusion reaction or blood transfusion reaction, and these can be immediate versus delayed. IgM is usually more involved with the immediate blood transfusion reactions, while the delayed transfusion reactions are usually IgG. Others include the hemolytic disease of the newborn and drug-induced hemolytic disease. The rest of my presentation, I'm going to try to walk you through a type 2 hypersensitivity reaction. The example I've chosen is HDN, or hemolytic disease of the newborn. And I'm going to kind of walk you through how that reaction takes place, and also a way that we control this reaction. So the example we have here is we have a woman who's for the first time pregnant, and she's type A, and she's rhesus negative, or Rh negative. And she's pregnant with a baby, a cute baby that you see there, with a blood type that's A, but this baby is Rh positive. So we have a mom that's for the first time pregnant, and the mom is Rh negative, but she has a positive Rh child, an Rh positive child. So what happens is the blood of the fetus, or the fetal blood, somehow seeps out into the mother's blood circulation. Because the mom doesn't make the Rh antigen, she's going to recognize the baby's blood as foreign. As you'll see, this is going to set up the immune reaction that causes type 2 hypersensitivity. So what's now happening in this slide is we have a baby's red blood cell that has encountered a mother's B cell. This mother's B cell is recognizing the Rh antigens on the surface of the baby's red blood cell. What it does is the B cell becomes partially active and it engulfs this baby's red blood cell and presents the Rh antigens on its MHC class II receptor. What it's trying to do is act as an antigen presenting cell to helper 2 T cells. The helper 2 T cell is going to come to this B cell, or it's going to encounter this B cell, and it's going to release cytokines if it recognizes the Rh antigen as well. And these cytokines are going to allow this B cell to proliferate and become the memory cell, become a memory B cell, but it's also going to become the effector plasma cell. So it's producing two kinds of cells. It's producing a memory B cell that's going to play a future role in future encounters of the Rh antigen, and it's also going to produce the plasma B cell that's going to make the immunoglobulin classes specific for the Rh antigen. Since this is the first time that these B cells have encountered the Rh antigen, the plasma cells produced are primarily going to make IgM, which are not going to be harmful to the baby because IgM can't cross the placenta. The problem of HDN arises when a mother who is Rh negative is for the second time carrying a child that has or expresses the Rh antigen. So in this scenario, it looks very identical. We have a mother who is blood type A and is negative for the Rh antigen, and she has a baby that, of all the chances, is type A and also has the Rh antigen. What's going to happen, as in the previous scenario, is these red blood cells, the baby's red blood cells, are going to yet leak into the mother's bloodstream again and cause another reaction. So, what happens here is eventually if there's enough of the baby's red blood in the mom's circulatory system, it, of all the chances, comes across the memory B cell that recognizes the Rh antigen. And as a result, it goes through and proliferates and produces plasma cells that make IgM, but it also makes the plasma cells that produce the IgG. And the IgG can cross the placenta. So as we already stated, in the second pregnancy, the anti-Rh antibody is mostly IgG, and this IgG can cross the placenta. The mom's anti-Rh IgG infiltrates through the placenta and sensitizes the baby's red blood cells. This is what causes the hypersensitivity type 2 reaction seen in the hemolytic disease of the newborn. So as I previously mentioned, we have something called ROGAM, which can help prevent hypersensitivity type 2 reactions. What ROGAM is, it's an IgG antibody that is also specific for the Rh antigen. How it works is we have this scenario where a mom is Rh negative, and for the second time she's pregnant with a baby that has the Rh antigen being expressed on its red blood cells. These red blood cells, the red blood cells from the fetus, do seep out into the mother's bloodstream. But what ROGAM's purpose is to bind to the Rh antigens expressed on the baby's red blood cell, and hence neutralize it and prevent it from being able to be recognized by the memory B cells. This mechanism allows for the memory B cells to not become active and produce the IgG that can cross placenta and hence create hemolytic disease of the newborn. Well, that sums up my portion of hypersensitivity reactions. I'm now going to introduce to you Jenny, who is going to talk to you about type 3 hypersensitivity reactions.
Thank you, Adrian. Hi, I'm Jenny, and I'm here today to talk to you about type 3 hypersensitivity reactions. By now you've learned the ins and outs of type 1 and type 2 hypersensitivities. Now it's time to learn how type 3 hypersensitivity is different. In a normal immune response, when an antigen enters a host, antibodies are created by plasma cells. These antibodies cover the antigen, resulting in antigen-antibody immune complexes and eventually destruction. However, this is not the case in type 3 hypersensitivity reactions. Now that we've had a mini refresher course, here's what's new. Everything starts out normal. The antigen enters the host and in this case is picked up by a B cell. Next, a Th2 cell helps in the conversion of a B cell into a plasma cell. Plasma cells then begin spitting out antibodies. The antibodies that are produced are mostly IgG antibodies. However, some can also be IgM. These antibodies then bind with the antigen to form antigen-antibody complexes. Next, these complexes become embedded into cells, such as blood vessels. This, as you can imagine, is not right. These complexes activate complement. C3a, C4a, and C5a cause mast cell degranulation, increasing vascular permeability. C3a, C5a, C5b67 are chemotactic for neutrophils. Immune complex-mediated inflammation is the last stage. This occurs when the neutrophils begin destroying the complexes by releasing lysosomal enzymes. Since blood vessels are getting destroyed and collagen is exposed, platelets begin to aggregate at the site of injury. The formation of a platelet plug cuts off blood flow and results in vasculitis and eventually disease. Here's a list of some diseases that are caused by a type 3 hypersensitivity reaction. Since I'm not able to discuss actual cases because of HIPAA, I will give you 2 probable cases. Here's the story of 2 friends and roommates living in Miami, Florida. This is Dorothy. She is a 55-year-old divorced substitute teacher residing in Miami, Florida. 2 days ago, Dorothy was working out on the lanai and stepped on a nail. Fearing she may get tetanus, she went to her doctor to receive a tetanus shot. However, about 8 hours later, her arm was in immense pain and was very swollen. Little did she know that she was experiencing a type 3 local hypersensitivity reaction. Dorothy is suffering from an artuse reaction. An artuse reaction is a local vasculitis caused by IgG immune complex deposition in skin blood vessels and activation of complement. This causes severe pain, edema, hemorrhage, and in severe cases, gangrene. Being worried about her condition, she returned to her doctor. The doctor knew almost immediately what was wrong. He explained that the immune complexes were deposited in her blood vessels. Even though her immune response was doing what it usually did, the deposition of the complexes caused the tissue damage. Luckily, with the help of some anti-inflammatory drugs, Dorothy will be her old self again in no time. This is Blanche, a self-stated 39-year-old woman who also currently resides in Miami, Florida. Lately, Blanche has been feeling poorly. Her joints have been hurting, her fingers and toes have been cold, she's been very fatigued, and a rash has appeared on her face. She goes to the doctor, and he recognizes the disease quickly. Blanche's doctor diagnoses her with systemic lupus erythematosus, or SLE. SLE is a disease in which the body's own immune system starts to destroy its own tissues instead of an antigen. The cause of SLE is still unknown, although scientists believe that the cause may either be genetic, viral, or environmental. It is known that SLE is more common in women than men and may be caused by certain drugs. As you can see from this picture, that SLE is a systemic type 3 hypersensitivity and affects many different sites of the body. Unfortunately, there is no cure for SLE. The only treatment is to treat the symptoms. Blanche's doctor prescribes her some corticosteroid cream for her rash, hydroxychloroquine for arthritic symptoms, and non-steroidal anti-inflammatory drugs for her joint pain. Even though Blanche is not feeling her best, her vanity is still intact. So in conclusion, the initial immune response starts out great. For unknown reasons, immune complexes begin to deposit in tissues or blood vessels, leading to tissue destruction, which eventually will lead to disease. Next up is Rochelle with type 4 hypersensitivities.
Hi, this is Rochelle. I may not have a presentation quite as humorous as my colleagues, but I hope you will find this presentation just as informative. What I would like you to ask you to contemplate is what would the effects of poison ivy or a honeybee sting or eating a piece of bread do to certain individuals and the effects that it might have on their body. You might be surprised by the answer. What all these have in common is they elicit a reaction from the body that is called type 4 hypersensitivity. This type of hypersensitivity is also known as delayed T-cell dependent hypersensitivity reactions. They're called this because the main immune cell involved in all of these reactions is a very special type of adaptive cell called the T-cell. Now, what I'd like to do is explain to you 3 of the different types of hypersensitivity reactions an individual might face. The 3 types of type 4 hypersensitivity reactions are contact dermatitis, which, as it notes, is you get from rubbing against certain poisonous plants. Usually these plants are very common in the state of Texas, unfortunately, and they are plants such as poison oak, poison ivy, and poison sumac. This is usually a localized skin reaction, but it is possible for it to become systemic and involve all parts of the body. The second type is delayed hypersensitivity. In this type of reaction, proteins from poisonous insects or animals, such as snakes, are the antigens which cause the reactions. These also include proteins from diseases such as Mycobacterium tuberculosis and the lepronin antigen of leprosy. In these circumstances, the foreign particles recognized by the body are all proteins. In gluten sensitivity enteropathy, or gluten allergy, gliadin is the guilty chemical in the allergic reaction in your intestines. It causes a type of very painful bloating and diarrhea, and it is quite a common disease now known as celiac disease. What is delayed type 4 hypersensitivity? Well, from these pictures, you can obviously determine that type 4 hypersensitivity is nothing pleasant that you wish to put your body through. To be precise, hypersensitivity is a delayed autoimmune reaction to an antigenic hapten. In this case of the poison ivy, the hapten is called pentadecacatechol. Pentadecacatechol is in the poison ivy plants. It's in their leaves, their roots, their stems. And when a person brushes up against it, or even on their clothes, that hapten is placed against their epithelial. Basically, what happens is our patient will have an exaggerated autoimmune response to an environmental allergen. Now, the first time you come in contact with poison oak, poison ivy, or poison sumac, you may think, I'm not allergic to that. I didn't have a reaction. We call this the primary or the sensitizing period, when a reaction was very mild or even undetectable. However, your body is busy reacting to that hapten. In this case, special dendritic cells in the skin, called Langerhans cells, recognize the pentadecacaticle as foreign. The antigen-presenting cells, APCs, relay the antigen to the lymph nodes. It is there that the cell-mediated part of the delayed hypersensitivity begins. This picture clearly illustrates what I'm trying to relate to you about the antigens and how your skin responds to that antigen. To continue, cell-mediated response refers to specialized cells of the immune system called T cells. There are many types of T cells, all of which belong to the adaptive type of immune response. T cells, such as cyclotoxic T and helper T1 and helper T2 cells, all require HLA class 1 or 2 molecules to be presented along with our allergen. In this case, the pentadecacaticle molecules. It usually necessitates 1 to 2 weeks for the body to become sensitized. During this time period, T cells are busy producing memory cells to respond to the antigen when it's encountered again. The T cells are presented with an antigen and respond, especially those Th1 helper cells. The memory class 2 antigen is also present. The antigen is now processed and T memory cells are developed in the body. For most patients, didn't have a reaction the first time because the immune system wasn't primed or sensitized to the poison ivy. Memory cells can remain for years in the human body, ready for quick reaction the next time the antigen is encountered. Cyclotoxic killer T cells will kill any cells which are inflamed and have encountered the antigen in the future. When our person has a second encounter, the memory's T cells are ready to respond, and they respond with some very specific chemicals. As these illustrations clearly show, the APC cells, the dendrites, present the antigen to the TD4 helper cells. These release cytokines that I mentioned earlier, the interferons, the interleukins, and they create a reaction out of the killer T cells, which start to damage the skin cells and create the inflammation and tissue damage that we see. What happens, however, is kind of like a cascading effect. As the CD8s kill one of the cells of the skin, they activate more and more cells to come and continue the damage. And as you can see, it spreads rapidly to large parts of the body. Now, T cells are part of the body's adaptive response. And unlike the body's innate response, like the skin or phagocytes, adaptive responses do take time to react. The hapten has to be processed by the Langerhans cells. Previously primed Th1 effector cells recognize the antigen and the MHC on the cells. They begin to mount a counterattack to this innocuous antigen. The Th1 cell releases very powerful chemicals. As the skin begins to die from the attack by his own body, the body attempts to repair the injury. However, the massive amount of phagocytes and inflammatory chemicals make it difficult. The body produces fibrin to fill in the empty spots, increasing the swelling. Eventually, a granuloma forms with macrophages and T cells surrounding the antigen at the center. All of this takes time for the body to process. As you can see from this illustration, the body's response to poison oak, poison ivy, poison sumac can be, well, very extensive. I would hate to be this individual. Next, I'd like to talk about the second type of hypersensitivity, type 4. These are antigens that are injected through the skin, whether intentionally or accidentally, through animals such as bees or snakes or other spiders or many arthropods. All of these put antigens into your body that the T cells will react to. However, it won't necessarily be the first time. It may be, again, this delayed reaction that will occur up to 48 or 72 hours later, or perhaps the second time that you are bitten by the insect or are injected, as in the case of the mycobacterium infections such as tuberculosis or leprosy, which are determined from hypersensitivity reactions to a small amount of injected microbial protein. Briefly, I'd like to show you the reactions that you receive when you are injected with a positive result from either the tuberculin antigen or the leperin, which is the antigen for leprosy. We're familiar with the TB one, but you're probably not too familiar with the positive test for leprosy, which is on the lower right-hand corner. We're all used to the immediate pain and swelling that we get from bee stings. However, a second time, the body may elicit a type 4 sensitivity response. In this case, the swelling and the tissue damage, as you can see from the lower picture, is far more extensive. And in some cases, this will become systemic and develop into anaphylactic shock. The third type of delayed type 4 hypersensitivity is gluten hypersensitivity, also known as celiac disease. In this case, production of IgG, IgM, and IgA antibodies also assist the T cells in doing extreme damage to the endothelial cells of the mucosal lining of the small intestine. Basically, think of this as an allergic reaction in your gut. As you can see from this illustration, the gluten, or the gliadin, is absorbed through the intestinal mucosa and absorbed by the macrophages. The T cells and the B cells respond, and what ends up happening is the microvilli, which are responsible for absorbing all the nutrients that we eat, undergo massive tissue damage and are destroyed in the process. This is a listing of all the signs and symptoms of celiac disease. As you can see, most of them are concentrated in your upper and lower intestine, and some of them are quite, shall we say, unfortunate in the company of others, such as gassiness or increased flatulence. Finally, I would like to end with a note on how the three different types of type 4 hypersensitivity are different from other hypersensitivity reactions that you heard about from my colleagues. Number one is the time that is involved for the reaction. It is not immediate. It tends to be 24 to 48 hours later, and in some cases, even 72. Also, it's important to note that no complement is ever involved in the process. In this response, T cells are the primary immune cells responsible for all the reactions. And also, you must note that B cells are not really actively involved in type 4 hypersensitivity. So this makes this a rather unique and different type of reaction. Thank you for your time.
Also, we would like to add that we do not own any of these images and that all these images have been cited on their respective pages